Welcome to another video from NCRM. I'm Dr. Scott Whitten at the Nevada Center for Reproductive Medicine. I'm going to talk to you today about questions I get asked all the time from my patients about general advice on health and lifestyle when you're trying to get pregnant or you're going through fertility treatments. What's the best way to live? What's the best things to eat? How should I behave? What things should I avoid? We get those questions all the time, so I'd like to convey some of those answers to you guys and make sure that you're all aware of kind of what the best approach would be to try to be in the most healthy possible position when you're trying for pregnancy so that you have the best outcomes available. So oftentimes I get asked about vitamins. Why am I taking prenatal vitamins? Prenatal vitamins for the female are actually quite important because there's two critical components of that vitamin that are really helpful for the early pregnancy. One of them is folic acid. There's a certain amount of folic acid required in a prenatal vitamin. It's a minimum of 400 micrograms or higher. Most of the prescription ones have 800 to 1,000. And what it's used for is to help prevent the neural tube defects, which is problems with closure of the spinal column. So that can be avoided when you're taking the folic acid. The other important additive to a prenatal vitamin is a source of omega-3 fatty acids. So there's really two sources that are primarily used, fish oil and then also a plant-based one called DHEA. Well, both these omega-3 fatty acids are really important for early neurological development in the fetus, as well as reducing things like postpartum depression in the woman. So it's important to be on prenatal vitamins 3 to 4 months before you're trying to conceive, all throughout your pregnancy, and then even into the time when you're breastfeeding. Okay? So other medications that are recommended for patients really is to just avoid ones that would be harmful to you. So you want to avoid toxic exposures, things like smoking, smoky environments, alcohol intake, excessive caffeine, marijuana use now that it's legal. There's a lot of things that you want to avoid, not necessarily take something that's going to make you healthier, but avoid things that are going to make you unhealthy. And those that can affect your eggs and sperm and the ability to get pregnant. Now, women aren't the only ones that need to behave while they're trying to conceive. Guys need to do the same thing. They also want to avoid those toxic exposures. But in addition to that, they also want to avoid excessive heat to the testicles. The testicles is where sperm is produced, and the reason that they're outside the body in the scrotum is because there's a different temperature that sperm are produced at. So if the male likes to have frequent hot tubs, saunas, steam rooms, long car rides, long bike rides, anything that's going to keep heat around the scrotum and the testes can actually impair his ability to make sperm and also the motility of the sperm. So guys need to avoid that if they can. So doing some of these simple behavioral changes can improve your ability to get pregnant and have a safe, healthy pregnancy, and that's what we all strive for. Thank you.